You'll recall that the appendicular skeleton consists of the upper and lower extremities as well as the bony girdles that attach them to the axoskeleton. When you talk about the upper extremity, it will be attached to the axoskeleton by the pectoral girdle. The pectoral girdle is formed by the clavicle and the scapula. Please do not call them collarbone and shoulder blade henceforth. Those are lay people's terms, and we are now anatomists. The clavicle is the most commonly broken bone in the body. The clavicle and the scapula will articulate with one another at the acromioclavicular joint. About 10% of shoulder dislocations are actually dislocations of that joint. The scapula will articulate with the head of the humerus in that glenoid fossa that we mentioned when we talked about fossas. This just shows you the clavicle. It can be categorized either as a flat bone or as a long bone. I learned it as a flat bone because of the way it ossifies, which is via intramembranous ossification. The scapula, once known as the shoulder blade, is actually a pretty interesting bone. It is crucial to having appropriate shoulder movement, and we'll talk a little bit about that when we get to the muscular system. Just a few angles so you can orient yourself. If there's a superior angle, what a surprise, there will be an inferior angle. There's a lateral border, which is going to have a corresponding medial border. Right in through here is the glenoid fossa. These diagrams call it the glenoid cavity. I learned it as the glenoid fossa because fossa implies a sort of flattened area. That is the area that will articulate with the humerus, forming the glenohumeral joint, the so-called shoulder joint. Another important landmark is the spine of the scapula, which will terminate in the acromion, which will terminate in the acromial process, which is what's going to articulate with the clavicle. The spine of the scapula sort of provides landmarks and attachment points for a couple of very important muscles in the rotator cuff group. The supraspinatus muscle, which will reside up here, and the infraspinatus muscle, which will reside here. Subscapularis will attach to the anterior aspect of the scapula. And I want you to think for a minute when you see a scapula, which is going to be a right scapula, and which will be the left scapula, and how can you tell? The way to do it is to use the spine of the scapula and the glenoid fossa to orient yourself. Remember that the glenoid fossa has to articulate with the humerus, and the spine of the scapula is on the posterior aspect of the scapula. And that makes it pretty easy. This shows you a lateral view of the scapula, looking from lateral to medial. I like this shot just because it shows you the glenoid fossa quite clearly. And the little line diagram on the left shows you where the various muscles that we mentioned, the supraspinatus muscle, the infraspinatus muscle, and the subscapularis will sit relative to the scapula.